Thank you very much for coming today. Let's welcome and give a round of applause and pass the time to Angela. Hi, Angela.
Hi, good afternoon, everyone. Can you hear me? Hope you can hear me okay. It is my honor to be a guest speaker today at this presentation. We'll be discussing smoking and lung cancer, especially impacting the Asian community. This is today's agenda. We'll talk about some data, then followed by human anatomy, basic human anatomy, lung functions. Then we're going to review some risk factors. We talk about tobacco smoking, lung cancer screening, and a harm reduction program. So the first slide we're going to see. Today's I'm using a lot of data based on network, either CDC, NCCN, which is our National Comprehensive Center Network, American Cancer Associations, and National Cancer Institutes. So this slide particularly is in 2018, top 10 new cancer cases diagnosed. As you can see, a lot of people get diagnosed with breast cancer as number one, prostate cancer, then lung cancer. However, you can see on this slide, more people die from lung cancer in 2018. This is another database. This is from the American Cancer Associations showing the similar rate. Now, this is breaking down in 2014, 2018, California women and men about their breakdown by gender. As you can see, men have more die from lung cancer, 33.2%, and women die from lung cancer, 24.1%, much more than breast cancer or prostate cancer. Especially in California. California is the home of the largest and most diverse population of Asian American, which include Native Hawaiian, which also include Japanese, Korean, Filipino, Chinese, Vietnamese. In 2010, the US Census Bureau showed that 4 top Asian counties that are growing the fastest, including LA, San Diego County, Sacramento County, and Alameda County. By showing you this photo, how fast Asian community are growing in California, if we put the previous slide combined, that lung cancer is the number 1 deadly disease in California. Is it having more Asian population in California? Is it more chance for these people to have lung cancer? Now we're going to move to part 2, which is our basic human anatomy. I'm going to briefly discuss this. I know it's a lot of overwhelming information, so I'm going to make it nice and simple. As you can see, this is a drawing of a lung in a person. On the right lung, there is 3 lobes, right upper, middle, and lower lobe. And the left lung, because of the heart, we have 2 lobes, which is the upper lobe and the lower lobe. I always use this scenario to compare is the lung is like a kitchen sponge, and they help us to exchange air, exchange oxygens, and work closely with our heart for pumping all the oxygen and blood supply around our bodies. Once the air goes through your nose, go through your nose, get down to your trachea, it will go down to all this little bronchus and then little alveoli down here. That's where all the heart working for air exchange and blood exchange at that time. Lung cancer typically start in the cell lining of the bronchial or the part of the lung, such as the alveoli area, which is the thin layer called the pleura around the lung. It protects our lungs to help that our lung can also, like right here, that slide. So when you breathe, you expand your lung and it slide up and force against the chest wall. So below the lung, there's a diaphragm, a dome shape. Right here is a muscle that help us to, it will move up and down for expanding and compressing the lung to force the air out. So this is a basic information for our lung function. Lung cancer risk factor. One is age, gender, race, socioeconomic status, diet, pre-existing lung disease, environmental pollutions, occupation exposure, genetic function factors, and behavioral factors, which I'm going to go for each single one on a slide. So the first slide we talk about is aging. Lung and bronchial cancer, overall lung cancer, percentage median age group that diagnosed is age 70. One of the reasons why we are doing, actually, there's a couple talks recently at the Washington at our Capitol in regarding to why are we finding lung cancer in such a late age. A is most of the patients are asymptomatic. B is because Medicare start kicking in at age 65. So a lot of people start seeking their medical treatment or their preventive care or screening around there. So you can see the spike from younger age is less, 55 starting, and then peak at 65 to 74. This photo is showing the rate of new lung cancer case. Again, divided by female and male, and this is particularly for Asian. Right here, Asian Pacific Islander, man, age about 45. The diagnosis rate is 45 out of 100,000, and then woman is right here, about 30. The next one after age is socioeconomic status. So studies show that the incidence of lung cancer increase in people with lower education level, lower income, and lower occupations. There are more greater prevalence of cigarette smoking. Third one that we're going to talk about risk factor is diet. So a lot of processed food can also increase with poor nutrition, excessive calories, dietitian fat, that can also, study also show that can lead to other cancers such as breast and colon cancer. There's no really direct link to lung cancer about diet. Of course, study is ongoing and we will learn more as times go on. Pre-existing lung disease. Emphysema, chronic obstructive pulmonary disease is called COPD. Idiopathic pulmonary fibrosis, or history of pneumonia or any kind of infection such as tuberculosis or the mycobacterium disease. Those are also like a pre-consistent conditions to develop lung cancer. As you know, most patients who smoke will get emphysema and COPD. Because your lung, once it's damaged, it cannot be reversed. So I have another picture later on to show you what that means. Our next risk factor is environmental. Secondhand smoking, indoor or air pollutions with cooking oil film or burning coal, exposure to chemicals such as radon, asbestos, and diesel exhale. And of course, outdoor pollution such as wildfire, which is happening a lot in California. Occupation exposure. There is, since 1982, we've been using a occupation list regarding to these people who work with this group of occupation that have higher risk of lung cancer, such as melting glass, asbestos production in constructions area, shipbuilding and constructions, especially who serve in our Navy and work in the boiling room. Other list B is another risk factor, such as meat productions, leather or woodwork, rubber, glass manufacture, and motor vehicle productions, such as our mechanic who work with our brake pads and wheels and tires. The next one is genetic. We know more than we did 20 years ago, but there's still more ongoing study. Of course, people ask if there is a family history of lung cancer, would that be similar to breast or colon cancer, that you have a higher chance? That is true, but however, we do not have a 100% direct link regarding to that. This is our main topic of the day, tobacco smoking, which is one of the behavior factors that we can change. All the previous 9 factors we talk about, we cannot change our age, we cannot change, we can change our diet in certain way. Environmental, yeah, we can participate and change some. But one of the, out of the 10 risk factors that we can do the most is tobacco. I always say picture worth 1,000 words. This is something that I find online, a normal chest x-ray with a bunch of cigarette butt on it. And we're gonna talk a little bit more about the smoking risk factor. Smoking is far by leading a risk factor for lung cancer. 80% of lung cancer deaths are through the result of smoking. And this number will probably even higher in small cell lung cancer. The risk factor of smoking lung cancer for smoker is many times higher than a non-smoker. Cigar smoking and pipe smoking are also as likely to cause lung cancer as cigarette smoking. Smoking low tar or light cigarette increase lung cancer chance risk as much as regular cigarette. Smoking menthol cigarettes might increase even more since the menthol allows smoker to inhale more deeply. In 2008, CDC stated that tobacco use is the #1 cause of preventable disease, disability, and death for all groups, including Asian American. In 2021, statistics show that it is associated with the top 3 killers of Asian American nationwide: heart disease, cancer, and stroke, which is all associated with smoking. This is a pictures of how many chemical that is in a cigarette. We estimate that we know only 70 that confirm with causing cancer, and within the cigarette, there's 7,000 components of chemical. We know about the nicotine, we know about the benzoyl, we know about all the other stuff that can cause us lung cancer. Smoking can also cause other cancer other than in the lung. So 80% we talk about can cause lung cancer, but the nicotine associated with progression of disease. Oh, sorry. I'm sorry, I'm in a meeting. For, sorry about that. With a progression of existing tumors, primary lung, colon, and gastric cancers. So this is a picture to how, drawing, I should say, how healthy lung look like. This is the little alveoli we talk about with all the air exchange. When you start having harmful particle in the alveoli, it go in, causes inflammations of the wall. And once it's damaged, it's an irreversible, most of the time, I would say, the irreversible for causing emphysema. So how can we prevent lung cancer? This, like we mentioned about before, the American Cancer Association, the National Health Institutions already have enough study to show smoking can cause heart disease because it did damage for our heart, and lung damage we just talked about. Also can do brain damages and other gum disease and other health risk. So how does smoking affecting your risk, your cancer risk? So in United States, smoking causes 20% of cancer, 30% of cancer death. 80% of lung cancer, as well, most of them are caused by the death are due to smoking in men and women. This is a really typical pictures. I used to work in a Chinese restaurant, and my uncles too, and the whole families are in, and that's what we usually see in our alley hallway, that everybody starts smoking back in those days. And once you start smoking, you got hooked on it. This is from a study that the prevalence for smoking cigarette in Asian community, Asian American. Interestingly, when you break this down, Korean smoke quite a bit, 20%, Vietnamese 16.3, Filipino 12.6, Japanese 10.2, Chinese especially around 7.6. Now this is a community that studied especially for native Pacifica, and this is the study between 2010 to 2013 for people who started age 18 and older. This is a breakdown of the previous slide. So basically, it tells you men and women, they break it down. Of course, men smoke more in, I would say, most population, right? Like even Korean, they're about the same, 20% men and 20% women. In Native Hawaiian, 36% men and 23% in women. In Chinese in particular, Chinese men spoke about 8.2%, and Chinese women is about 1.7%. So if people who smoke, what can they do to prevent lung cancer? One of the things that we offer is now, we learned, is called a lung cancer screening program. It's a low-dose chest CT scan that can pick up the most detail of your lung parenchyma and your lung anatomy. Screening chest X-ray can see some, but not detailed enough, or the sputum cytology we are still doing study right now that we don't have enough data to show that a sputum or blood work can diagnose lung cancer. But again, there's a lot of clinical trials going on, so maybe in one day, we don't have to do a CT scan exposed to all this radiation. But as of right now, CT scan is still recommended for diagnosing lung cancer. There is a big clinical trial. It's called National Lung Cancer Screening Trial back in 2002 to 2004. We have about 53,000 participants, and based on the 2 annual low-dose CT scan, and they randomized into 2 groups. Based on that result, we have a really good recommendation that come out. So this is only an example for 2 national institutions. One of them is National Comprehensive Cancer Network that we use a lot. Is NCCN, who develop a lot of guidelines for us for not only lung cancer, but any other cancer. And the other one is American College Chest Physicians. So basically one of the criteria is like 55 to 74, smoke more than 30 pack, or have a history of quitting smoking, less than 15 years. Or people who are 50 or more, smoke 20 years with additional risk factor, like we talk about secondhand smoking. So those are the 2 pretty similar based on the age and the history of smoking. So this is one of the detail about the previous, I mentioned the National Lung Screening Trial that we talk about. Over the period of the study, that's 40% had positive CT result using the consistent small, intimate, following the pulmonary nodules, suspicious for lung cancer. And the trial showed 20% increased survival rate with just going through the low-dose CT scan in a high-risk population. Again, people who used to smoke or still currently smoking. This is one of the Stanford Hospital developed our own criteria. This is one of the criteria. Age between 55 to 80, who is currently smoker or have quit within the 15 years. And how much do they smoke? Usually about 30 pack. If someone who spoke 2 pack a day for 10 years, then their average of smoking is about 20 pack year history. this is criteria number 2, similar to the NCCN guideline, is if they are 50 or older, they smoke at least 20 pack history, and also have other secondhand exposure for smoking is one of the risk factor. This is what the other risk factor we just mentioned about, if they have exposure to radon, exposure to occupations, or history of any kind of cancer, such as lymphoma, head and neck cancer, or history of family cancer, family history of lung cancer. Or some of them already have like pre-existing condition like we talk about, who had COPD, who had other kind of pulmonary fibrosis. Those are adding into our criteria to consider a lung cancer screening. This is from the website at Stanford for our lung cancer screening program. We currently, anyone who think they're qualified can talk to the primary care doctors, and they will put a referral into a lung cancer screening program, which we will, first appointment setup is to go over the risk and the benefit of the program for lung cancer screening and the risk of possible finding and radiations exposures. So we do a consultation first before we schedule the CT scan. So the next session is the harm reduction and smoking cessation part. Oh, sorry, this is one of the really good radiation brochure that Stanford developed by our radiology department. It kind of tell you what the eligibility will be about and to scheduling the radiation appointment, which is, I find, pretty useful if people are not too tech savvy for going onto the website. So I've been talking for half an hour now, or 20 minutes now, with a lot of information. I sometimes think it's a little overwhelming. So let's do a little bit of review. The CDC, the Center of Disease Control and Preventions, already again emphasized, many studies show cigarette smoking is the #1 risk factor for lung cancer. People who smoke cigarette are 15 to 30 times more likely to develop cancer. Not only just lung, cigarette smoking can cause other cancers such as mouth, throat, esophageal, stomach, colon, rectum, liver, pancreas, your larynx, which is your voice box, lung cancer, that's what it stands for right here, kidney, renal, pelvis, and bladder cancer. However, quitting smoking at any age can lower the risk of lung cancer. This is the most important PowerPoint for my whole presentations, out of my 50 slide, because it's never too late to quit smoking. I think that's #1. No matter how much you smoke, no matter how many times that you try to quit and smoke again, it's never too late to quit smoking. Interestingly, I find this information in our Asian community websites. When I'm doing my research, we find out that people, again, among Asian who currently smoke daily, age 18 and older, interesting, 69.6% that they want to quit. And most of them did try to quit. And it's really important in this slide telling you that, once you get hooked to nicotine, you keep smoking. And a lot of people know that they need to quit and they try to quit. But a lot of time it's like attempting, because quitting smoking is not easy. Sometimes you have to do more than once, twice, 3 times to keep trying to quit smoking. So intervention to decrease risk for lung cancer. Hope that it gets to you now, is try to start smoking. And if you're still smoking, please consider to try to quit. Compared to 20 years ago, we have a lot more health pharmaceutical-wise to quit smoking. We have patches, gum, inhaler. We also have other kind of help for quitting smoking by, which later on the presentation we'll talk about, is to do acupuncture or even psychologically, hypnosis, and things like that to help. The other thing is smoke-free workplace and legislation. California is such a leading state out of the 50 states, that one of the first one to stop smoking in public, such as restaurant, theater. I think that will help not only, hopefully help people to quit because you can't go smoke anywhere else, but also others to expose to lung cancer. And the other one is preventing occupation exposure to lung cancer. We now know that most of our contractors do have to wear those special masks to prevent them for exposing to all this chemical. And also firefighter too, they have special gear to prevent for exposing to all the chemical during a wildfire. Factor that's uncertain about or proof affecting for lung cancer risk factor. Smoking marijuana, e-cigarette. Again, study is ongoing. E-cigarette actually is pretty dangerous, which we're going to talk a little bit about later too, because there's a lot of chemical, unknown chemical, heated in this little small device, and quote unquote supposed to try you to get away from regular cigarette, but there's still a lot of more concentrated nicotine in there. And by burning those chemical and you're inhaling in the lungs, we really don't have enough data to support that. Are we helping to quit, or are we harming more lung tissue that way? So is marijuana, because marijuana don't have a standard growth protocol. It's depending on where the product come from and how pure they are and things. But I would say anything that you inhale into the lung, if you think it's going to damage your lung, please don't, because it's irreversible process that your lung will not, most of the time will not heal from all this chemical. How about cigar, right? Smoking cigar has almost the same toxin and carcinogens component as cigarettes, but some of them are present at a different level. Again, I would say any cigar, e-cigarette, or marijuana, when you smoke, once the damage is done from the chemical, it's irreversible. This is some of the online resources for CDC, American Cancer Association, and lung organizations that you can find a lot of useful information from. Most of my slides are from this organizations who are doing a lot of studies. I hope this will help you to understanding the dangers of smoking. If you are grandparents, or if you are set a good example for your next generations that to come, is to set them as like a non-smoking environment and try to quit smoking to help them to understand how cigarette can damage the lung and to quit smoking for them. Thank you.
Hello, everyone. Thank you again, Avenidas, for having us here today. We are honored to share our knowledge, and I'm excited to share a little bit more about the effects of tobacco on the lungs. So before we move on, I'm going to make an assumption here that many of you have attempted to quit smoking in the past, and I'm sure many have tried at least 2 or 3 times. Statistically speaking, it takes about 8 to 11 tries before a person is able to permanently quit. How do we quit though? And where does it start? So as Angela had mentioned before about the age group of 18 and over wanting to quit, but how did they get there? And you can see here our current effects in the younger generation. It starts as early as middle school. So you could see, as Angela mentioned, the e-cigarette use. We have students in the Asian community starting e-cigarette use at 3.9% compared to 0.4% smoking regular cigarettes. It increases significantly once they get into the high school ages, so anywhere between 14 to 17. And this e-cigarette use jumps from 3.9% to 13.7%. That's almost 4 times. And it also increases with the smoking of cigarettes. And as Angela mentioned in the previous slides, the demographics between the Asian communities, between Korean, Vietnamese, Chinese, and Asian Indians, it's more prevalent in the Korean community. So what can we do? Next. I'd like to first show what lungs look like. from non-exposed versus exposed. So right where we're getting circled right now, that's a normal chest CT. That is typically what a normal non-smoker, healthy lungs, not exposed to any sort of tobacco or vape products would look like. The middle is where a patient has been exposed to e-cigarettes. Why are they so highlighted? So what that is an inflammation caused from the smoking. So as you see in the normal CT, you'll see spots of white. That's normal dilation compared to that's heavily dilated and again, caused by the smoke inhalation. And you can also see in the spine how that is also affected from the smoking. So, and then that's the smoker's lung. So that's typically someone that's smoking pack a day, anywhere from half a pack a day to a pack a day. And you could see the tar buildup in the lungs. So what we would normally like to see is more of the fleshy colored lung that you could see. It's more pink, what we would normally see in a healthy person. So what happens in the quit smoking timeline? So much can happen within 20 minutes of you stopping smoking. So one of the causes of smoking is high blood pressure. So with that, once you stop smoking, within 20 minutes, your heart rate drops. So that's going to give you an opportunity to start rebuilding your oxygen levels into your system, which then are going to influence a lot of other ways of how your organs rebuild themselves. And you'll see that you start to have, within 2 weeks to 3 months, your risk of heart attack significantly drops down and your lung function begins to improve. Within that time frame, I know that a lot of patients that tend to smoke, they tend to have a cough, a smoker's cough, and that can be very irritating. Within that time frame, you'll see that you stop having those coughs, and your lungs and the cilia within that area starts to rebuild itself. Within 1 year, your added risk of coronary heart disease is it's half of that of a smoker. So within 1 year of stopping, you have a significant change in the way that your body is starting to heal and the way that it's able to not have a risk of a heart attack. So next slide, please. And I'd like to also add, it's never too late to quit, as Angela mentioned. So what can we do to stop smoking? Essentially, smoking is a habit, first and foremost. So I'd like to share with you a couple examples that seem to be helpful with patients. The first one is the 5 Ds: delay, drink water, distract, deep breathing, and discuss. So delay, one of the things is, how long can I push the cigarette, my next cigarette? I know some patients start as early as the first thing that they do in the morning. They go for their nightstand and then they reach for a cigarette. Instead of doing that, rather go brush your teeth, get yourself ready, and then delay it as long as possible. Oftentimes, we also, with eating especially, we tend to eat more rather than drink water, when in fact our body is just craving the water. Drinking water can also push the cigarette and delay it. Distracting ourselves. I know that there's a lot of hand to mouth, a lot of keeping your hands busy. So finding things that are going to be helpful to distract yourself. I know within COVID and the pandemic time, a lot of patients have found a lot of comfort in gardening, crocheting, again, baking. Baking was really huge. So finding things that are going to be distracting so that you can delay, again, the next cigarette that you're going to be using. And a lot of times, what are you doing when you're smoking? You're taking some deep breaths that oftentimes we don't even realize that we're so short of breath. So maybe taking a couple of minutes to think about, why am I doing this? Just riding the wave of cravings. You can't push back. You just have to ride it and take a couple of deep breaths and realize it'll pass. And that's something that you can also discuss with someone that may be in your family that could motivate you, that is holding you accountable, that perhaps you'd like to even attend group therapy, one-on-one counseling, something of that nature to, again, hold ourselves accountable for what we're doing. And you also have to find your motivation, right? Because at the end of the day, we're often told, you have to do this, you have to do that. But why are you wanting to do it? Unless you've really found that motivator, be it your health, oftentimes once a patient's diagnosed, that's sometimes what they need to say, okay, this is it, I'm done. Their family. Family is such a huge motivator, be it your spouse, your children, your grandchildren. A lot of times it's always the grandchildren. And lastly, the financial aspect of smoking. I know that I have patients that say cigarettes tend to cost them pennies because they buy the tobacco and they roll it themselves. But that's a lot of time for yourself as well that you're spending that you could be doing something else. And if you're buying the packs, and if not cartons of cigarettes, you're spending a lot of money there as well. The alternative is approaching it from a holistic approach. We also offer a variety of services. Hypnosis, as Angela mentioned, is wonderful. Acupuncture, and again, the one-on-one counseling and group therapy. So I know oftentimes we try to go with medication first and foremost. So what are the cause and effects of cessation medication? The first one that I always love to share with patients, because it's the least invasive, is the nicotine replacement therapy. So that includes nicotine patches, nicotine gum, and nicotine lozenges. Oftentimes, physicians don't always have the time to go through what each one does and how to properly use it. That's always something that you can reach out to your pharmacist to further discuss. The alternative to that would be Chantix. Chantix is a prescription medication that you would have to meet with your physician. They would go ahead and assess if that's something that would be beneficial to you. It's a wonderful medication if you're able to take it. Similar to Chantix, we have Wellbutrin, another wonderful medication that was first identified as an antidepressant and later found to have cessation properties. But what are the effects of using them? So NRTs, oftentimes patients smoke on top of having the patch or using the gum as well. That can lead to a nicotine overdose. And what that'll do is it'll give you nausea, headache, dizziness, and racing of the heart. So again, that high increased blood pressure. Chantix, while it reduces the effects of, if you smoke on top of Chantix, you're reducing the effects of Chantix because they compete for the same nicotine receptor. So once you're on Chantix, you want to be sure that you give yourself a certain amount of days. After 7 days, ideally patients are stopping all forms of tobacco. And then Wellbutrin may increase blood pressure. So it's very important to discuss Chantix, both Chantix and Wellbutrin, with your physician. Next slide. Okay, and as Angela mentioned, I know that oftentimes vaping has been discussed as a cessation tool. At this time, there is no substantial evidence to support the use of e-cigarettes as a tool to quit all tobacco products. Essentially, what you're doing is you're going from one bad habit to another. And as she mentioned, there is no evidence to show that it's going to help you quit because you're still inhaling the smoke. And that essentially is what we're trying to eliminate, because that is going to affect many other things. And it has not been approved by the FDA. So thank you again. I really appreciate you all for allowing us to be here today and share a little bit of our knowledge.
Thank you so much, Maureen. This is such a small impact information group. Within 40 minutes, we went through a lot of information from Asian populations to cancer to smoking. Technology is good nowadays. You can always go back to these references, especially we're going to put it up on YouTube, and you can always go back to the slide. I would highly encourage anyone, if currently right now we're going to do a question Q&A session. So if anyone have questions, feel free to type into our little box of the Q&A, and we can answer them in person right now, either from quitting smoking or any question about lung cancer in general. But I will highly encourage you, once you have time to review this, talk to your primary care physicians, talk to anyone about your concern either from smoking or chemical exposure because of your occupation health that may increase you for lung cancers. And even though if you are a candidate or not for the lung cancer screening, it's always good to ask questions, and hopefully your provider will get you the correct answer, if not to refer you to the appropriate service for lung cancer screening. Thank you so much for your time. And again, right now we will be open for any Q&A, question and answers for either me or Maureen.
As some of you guys are probably typing the questions in the Q&A section, feel free to do that right now. In the meanwhile, I believe Pinky has a couple of information items that she would like to share with you while we wait for the questions to come in.
Sure. How about go ahead, we see one question, Q&A.
Oh, yes. Do e-cigarettes cause inflammation of the liver and the lung?
As far as I know, e-cigarettes is inhaled, so it will definitely damage and cause inflammation to the lung. But however, when you inhale those, the nicotine also go into the bloodstream, so it might cause some damage in the liver. I don't know if there's literature supporting that. Again, e-cigarette is pretty new for the last couple of years. Maureen, do you have any additional info that you want to add into these questions to answer?
I think you summarized it. A lot of the times what we're most concerned with is the smoke going into your system. So that's something that has to be highly taken into consideration. While you might not see something as you saw with the CT scan, there might be other things that trigger. I'm not well versed in that. That may in fact trigger some sort of liver or kidney. I'm sorry, was it the liver and
liver, the lung?
No. Lung. So definitely the lungs for sure. Liver not so much, but it is metabolized in that way. So something to take into consideration.
Thank you.
Thank you, Angela and Maureen. And I, at this time, there's no more questions. If you do have any questions, feel free to type it in the Q&A. Oh, there actually is another one. So, is lung cancer more prevalent in smokers that reside in smog-heavy areas?
That is a good question. I don't think there's study for people who are in the area who have a lot of pollutions, right? I mean, back in the 1980s and 90s, LA has such a big air pollution area. If you're a smoker, I think that just prime you for another risk factor with the air pollutions, externally environmental, and on top of the smoking. Because the air is already so polluted, so lack of oxygen, and then by the time you're still smoking and you're not taking enough oxygen to your body, so those are like a double whammy, I would call it. But I don't think there's a particular study showing that people who, at the smog heavy area who smoke will have more lung cancer than others.
Anything else to add, Maura?
No, I was going to actually just state, and I believe in a few years we'll probably see more evidence or data to support any which way, especially in California with the fires that we're currently going through each and every year. And we saw it last year when the sky was very orange. So I think we'll have more evidence later down the road to support or disprove that.
Thank you. Just want to say thank you so much for taking your time, Angela and Maura. And I want to special thanks for Stanford Health team. Thank you for sharing the screen for me. And Avenidas Chinese Community Center is located in Palo Alto, and we provide bilingual services, classes, and program. To learn more information on our website, Avenidas Chinese Community Center. And if you have more questions of our online classes that what we're offering right now, Monday through Friday, you're welcome to email to us, accc@avenidas.org. Be safe and well. Thank you. 谢谢.
Thank you all.
Thank you.
Thank you.
Bye.